Hey, I'm Dr. Brian McKay of Core Health in Darien, and today I'm going to speak to you about tennis elbow. And this is going to be a pretty interesting video because I'm going to actually demonstrate on myself. And what we do that differentiates us from just about anybody else doing this treatment for tennis elbow is we use a multifaceted approach to treating it. What I'd like to demonstrate, first and foremost, what we call the Groston technique, which is a great soft tissue technique for removing what we call adhesions in the myofascial plane. Might be losing you on the terminology, but I'd like you to think about a pound of hamburger meat inside a Ziploc bag. The meat is the muscle, the bag is the fascia, or the covering on the muscle. And a lot of times that covering gets heated up, creates friction, becomes painful to move, and we have a great technique that really restores or takes out the adhesions and allows the tissue to move more fluidly and takes a lot of pain out. It's very effective. It's also very quick, which is one of the best things. So what I'm going to demonstrate first, and that's the Groston technique. So I'm going to prepare my elbow because, as a matter of fact, right now I'm actually experiencing some of this myself. So what I'm going to do is apply lubricant and take a special tool. This is called the Groston tool. I'm going to go over the tissue here. And what I feel as I do this is I feel a grit. And what the grit is the adhesions that form inside or outside the muscle and what we call the fascia. This technique originally had its origination in Oriental medicine, where people would use coins, which is a piece of metal. Obviously, it's not as sophisticated as this, but they would use a coin to go over these painful adhesions. And we lost power. No, you can take that out. Okay. So as you see, I go over the point of the elbow because right now, not that I'm a tennis player, but I am having tennis elbow as a result of doing so many treatment notes. My elbow started acting up. So the good thing is I have an idea what people go through with the pain. So this part of the procedure takes about 7 or 8 minutes. I'm just trying to demonstrate because if you see it, you can see, well, it seems very benign, but the fact of the matter is it's very, very effective. So this is the one part of the treatment. I said it's multifaceted. And what I like to do is, actually, it feels really good. It's a little painful, and I don't know if you can hear the adhesions kind of like bubble wrap underneath the skin. That's the kind of a noise it makes. So after doing this for about 9 to 10 minutes, we stop. I'm going to stop for brevity's sake today. We're going to make sure this plays out. What I want to demonstrate now is what we found to be an extremely effective way, an adjunct to this, is using cold laser. This is not something you're supposed to do at home because the light is kind of dangerous. But this is cold laser, which penetrates the skin and allows for photons of light to come in, photons and packets of energy comes into the skin and starts the healing process, because the Groston technique actually starts an inflammatory process, and by putting light or energy into it, we start to heal. And this part of the treatment is, again, about 5-6 minute part of the treatment. You don't have to touch the surface of the skin. You go over it, and you continue to do so. So this is the cold laser part. So between using the cold laser and there you go, using the cold laser and the Groston technique, we have incredible results with tennis elbow. And now that we're coming up into warmer months, we're going to be seeing a lot more tennis elbow, but to have an understanding of it is even more important. So once again, I'm Dr. Brian McKay of Core Health. Today we brought to you a wonderful treatment, demonstrated treatment for elbow pain, tennis elbow, called the Groston technique, and making it doubly effective by using cold laser. Cold laser, Groston, great combination. If we can help you, please call the number below, and we'll get in touch with you. Thanks very much. Have a great day.